Hi, my name is Divakar Gupta, and I'm an assistant professor at the Duke Eye Center, and I'd like to present to you this talk on virtual counseling. I have no relevant financial disclosures for this talk. Counseling has been performed in other medical subspecialties, but during the COVID-19 pandemic, there was an increased adoption of telehealth or virtual counseling. Here's a couple of examples from the literature that were published over the last year. The upper left is an example of nutrition education being given to patients with celiac disease. And the bottom right, we see telehealth counseling being used in patients with substance abuse. These are great use cases, but what exactly is telehealth or virtual counseling, and how can we use it in ophthalmology? As I see it, virtual counseling is an opportunity for you to build rapport, to educate and advise patients via virtual or telehealth platform. It's an opportunity for you to convey difficult or complicated information. This is information that may be additional to what you would give during an in-person session, or to reinforce information that is given during a more normal visit. It's also an opportunity for you to demonstrate your expertise. As I see it, any opportunity for you to interact with your patients is an opportunity for you to improve the patient-provider relationship and for them to have greater confidence in the care that you provide. So what are some examples of telecounseling in ophthalmology? This is not an exhaustive list, but just some examples. One is in the discussion of cataract surgery premium IOLs. Sometimes there is not enough information during an in-office setting to discuss all the different options available to a patient and to also discuss the trade-offs of these various premium IOLs. Laser refractive surgery is another example. Pre-surgical or pre-procedural counseling so that a patient understands and feels informed prior to a procedure. Genetic counseling, or to discuss very complicated pathologies such as uveitis or ocular oncology. There's also a use case in chronic disease management, such as age-related macular degeneration or glaucoma care. During the pandemic, our group did use virtual counseling to improve medication adherence and to give coaching tips to some of our patients with glaucoma. What are the advantages of telehealth or virtual counseling? Well, one is that there's greater time to discuss certain topics. This can not only save in office time, but also make sure that the patient's questions get answered. Also, multiple family members can now be present. This wasn't always possible during the pandemic when patients' families were not necessarily always allowed to accompany the patient. Also, family members may not be able to make it during the workday when we have clinic, or they may be out of city or out of town. And so virtual counseling gives us the opportunity to discuss things with other family members if the patient so desires. You have some more time to synergize all available data. Sometimes we don't have all the data that we need during a clinic visit. And so the opportunity to either get pieces of data, to obtain pieces of data, and to synergize all that data in a virtual counseling visit is important. You're invited into the patient's home where they maybe feel more comfortable discussing certain topics. You can also perform assessments of adherence or compliance. We did that in our patients with glaucoma. We could actually see how well they put in eye drops in their eyes. Also, in my experience, virtual counseling is a huge patient satisfier. How do you bill for these visits? Well, if there's medical decision-making that's happening at the time of counseling, then you certainly can use the E&M codes that are available for that. And here's a chart that was made by the AAO to explain the various codes that can be used based on time or the level of medical decision-making that's going on. There's also certain codes that can be used if these services are provided by a qualified non-physician, but that doesn't always happen in ophthalmology. There's also billing codes that are available if you do virtual counseling via telephone call. Just note that these codes should not be used if the counseling is performed the day before or within a week after an in-person visit. But otherwise, if they're done outside of that time window, they can be billed for. Thank you for your attention on the topic of virtual counseling. My email is provided. Should you have any questions, please feel free to email me.